Plastic Surgery Talk, brought to you by Mentor, maker of memory gel breast implants.
Despite the impression we get from television these days, there's more to breast than just selling beer. We're going to be talking about breast health, regardless whether or not you've had plastic surgery. Stay tuned, we'll be right back. Welcome to everybody's favorite show, Plastic Surgery Talk. Today, we're going to be talking about breast health and what women need to know at every stage of life. We actually got a group of viewers together for a roundtable discussion, and it turns out that they had more questions than answers. Let's take a look.
Welcome everyone to the Breast Health Roundtable. I wanted to share some recent statistics with you. 70% of babies out there have been breastfed at one time or another. Breast implants are the #1 plastic surgery procedure, and breast cancer is the most common cancer among women.
I realize that breast cancer is the #1 concern almost every woman has, but what other breast health issues are there in addition?
Has anyone heard of not wearing underwires with breast implants?
Is it better to wear your bra all the time to help support yourself and so it doesn't cause the sagging?
Nursing your children, is that better for your breast?
I wonder if it's true that you're statistically less likely to get breast cancer after you've breastfed a child.
Having breast implants, would that make it harder to detect cancer?
Who does self-breast exams?
I'm not quite sure what the full exam is at this point.
I was told that you're supposed to do it right after you finish your cycle.
Caffeine, maybe certain things in your diet can add to lumps. I've heard that before.
I know some people have detected lumps, and I've heard they were calcium lumps.
I'm wondering if there's an age limit that you should get breast implants or not. I mean, is 17 too young? Is 18 too young?
Has anybody heard there's different types of mammograms? There's the digital mammogram and then the conventional mammogram.
Thank you, ladies, for coming out and joining us with this discussion. And I think everyone's going to learn something from this. And that wraps it up, and back to the studio.
With me in the studio today is Dr. Carolyn Glicksman from Seagirt, New Jersey. She has an 18-year history focus on women's breast health. She's been a clinical investigator for 5 breast implant studies. She's been on Fox News, ABC, and MSNBC, and she's credited for bringing more patients to the FDA hearings on silicone safety than any other physician in the country. Caroline, it's great to have you here.
Oh, thanks. It's great to be here today. Great to see you again.
Tell us just a little bit about it. I know it's incredibly hard to get patients to come in for follow-up sometimes, and you seem to have gotten how many patients to the FDA hearings in 2006?
I had about 11 patients come down to the hearings, which was a great challenge to get those patients to come down. But I think that the women were so motivated by the controversy at that time. It was really about a woman's ability to choose what she wanted to place in her own body. Once we had the science and the safety out there, and the women knew that they were being limited by a decision that the FDA had made previously, and really wanted to do something to help other women. So we loaded them up in cars and trains and brought them down, and they each spoke a little bit about their own stories, and I think that really helped persuade the FDA.
Well, it's been certainly many plastic surgeons are indebted to you for that time and effort, because I know it wasn't easy, but the patient's input to the whole breast implant paradigm shift that we've seen in the past 10 years has been very, very impactful. So thank you very much for that effort.
It was a great achievement.
So, I think you saw in our roundtable discussion, the patients had an incredible amount of questions, probably much more than we have time for today. But, breast health is a unique thing because as you know, we don't talk about elbow health or belly button health, but breast health is a real entity. And I wanted you to just start off by, what is breast health and why is it important to women?
Well, unlike other organs, I think, our breasts change over our lifetime. You know, you start with breast development in adolescence, then you become a young woman. Women go on to have children, they're breastfeeding from these breasts, then they go on to have changes in their breasts as they mature, and then eventually menopause. So it's very important that women understand their own anatomy, understand their own breasts as they change over the course of their lifetime. Certainly, you know, breast health awareness is very current because of, you know, the statistics out there. 1 in 8 women in the United States will develop a breast cancer in their lifetime. So we have educational tools out there now, from early education in middle schools all the way up through the different community outreach programs. It's very important that women understand breast health.
It's an incredibly important topic. We've learned so much about breast health in the past 10 to 15 years, and I think it's made an impact on the way women live their lives and their quality of life as time goes on. So what I'd like to do is go through some of the specific questions our viewers in a roundtable ask, because I think that addresses a lot of the interest. So we're going to take a short break, and then Caroline, we're going to put you to work and have you start answering some of those questions.
Terrific.
We'll be right back.
Grow lashes. Grow longer, grow fuller, and darker lashes.
Grow? How's that possible? I'm using Latisse, the first and only FDA-approved prescription treatment for inadequate or not enough lashes. Applied nightly as instructed by your doctor, Latisse grows lashes in as little as 8 weeks, with full results in 12 to 16.
If you are using prescription products for lowering eye pressure or have a history of eye pressure problems, only use Latisse under close doctor care. May cause eyelid skin darkening, which may be reversible, and there is potential for increased brown iris pigmentation, which is likely permanent. If you develop or experience any eye problems or have eye surgery, consult your doctor immediately. Common side effects include itchy eyes and eye redness.
Grow longer, fuller, darker lashes. Ask your doctor if Latisse is right for you. Find a doctor at latisse.com today.
Welcome back. We're talking about breast health today with Dr. Carolyn Glicksman. Several questions came up during our roundtable. Caroline, let's take a look at the first question.
I would actually be a prime candidate for breast augmentation, but since cancer does run in my family, and unfortunately I lost my mother to breast cancer, I'm real hesitant to actually go through with the breast augmentation surgery. And I would really like to know, would having implants compromise breast health?
Okay, Caroline, that probably is the #1 question.
That's a terrific question.
What do you think?
That's really the concern of most women out there, and that's really been studied very thoroughly over the years. We really know that with the statistics showing that 1 in 8 women have breast cancer, it means that many, many women have primary, which means first-degree relatives, a mother or a sister, who may have had breast cancer, and they're very concerned. With good breast health in this country, which means screenings for women at high risk at the age of 30 and up, we really try to follow the American Cancer Society guidelines. So somewhere about the age of 35, women should get a screening mammography. What's very important to know that, you know, if somebody's self-image is really calling for them, they really have a need to get a breast enlargement, a breast augmentation, then they need to do it safely, and they need to do their homework. So very important that they do get screened accurately at the proper for their age level. And then if they do go on to have breast augmentation, that they make sure that they follow up closely with their OBGYN, with their plastic surgeon, and get the proper imaging that they're going to need over their lifetime to watch that implant and to watch their breast tissue carefully. But it should not be a concern if they are very careful and do their homework.